Okay, it is now 12:31 and we've only got half an hour, so I'm going to jump in and make a start. So welcome everybody to this webinar. I'm really looking forward to sharing more with you about what the National Cancer Plan contains and what this means for brain tumour patients. A bit of housekeeping, this is being recorded. And for those of you that don't know me, I'm Karen Noble and I'm the Director of Research Policy and Innovation at Brain Tumour Research. So first of all, I want to take an opportunity to reflect on a really important milestone, the National Cancer Plan. England's National Cancer Plan is the first for 10 years, and it's a long-term strategy to transform cancer care and outcomes across the country with the overarching ambition that 75% of people diagnosed with cancer from 2035 will be either cancer-free or living well after diagnosis, up from around 60% today. I'll comment on this statistic about brain tumour patients later during the webinar. All NHS cancer waiting time standards will be met by March 2029, so that refers to faster diagnosis and treatment. And the plan covers a full cancer pathway, so that covers prevention, early diagnosis, treatment, research, personalised support, and living with and after cancer. This plan obviously applies to all cancers, but crucially, for the first time, it includes explicit commitments to rare and less common cancers, and brain tumours are included in that category. So with this recognition of brain tumours, while there's a long way to go and much to ensure that it does take place, we're optimistic that this plan represents good news for the community, and I'll cover more about this during the webinar. Much work has been done by our organisation, by Brain Tumour Research, by our partners and our campaigners, and we've no doubt that the work played by us, by you, and by them has played a significant role in ensuring that brain tumours get extensive coverage in the plan. So not least today is a way to recognise and thank you, the brain tumour community, for all that you've done over a long time. So the order of today is I'm going to give you a really small update on Brain Tumour Research's campaigning commitments, because I think that helps put into context more about the National Cancer Plan. I'm going to explain how we fed into the plan, headlines from the National Cancer Plan, and then absolutely open for any questions. I will ask you at the end to put up your electronic hand, and you can either share your question through speaking or you're very welcome to use the chat feature as well. Okay, but before we dive into the National Cancer Plan, as I said, I thought it'd be useful to share with you what our campaigning commitments are. These are our charity priorities, what we campaign for, what we influence, what we engage, and what we lobby on each and every day. We use a variety of approaches and tools, and those can include meeting with parliamentarians and policymakers in England and the devolved nations. We send letters to decision makers, we submit questions, we support with briefings, and we hold the secretariat of the all-party parliamentary group on brain tumours and the cross-party group in Scotland. And we ensure through those that the challenges that are crucial to the community are discussed and actions agreed at those meetings. So, as I said, very briefly, what are Brain Tumour Research's campaigning commitments? We have three overarching commitments. The first one is about government funding to support increased research spend. And the actual figures get tweaked each year depending on what the national investment is. But we're saying we want the government funding to increase to enable more research to be funded. And we want it to go from its current level from about 20 million, and we want that to increase to around 35 million by 2028. So this commitment is all about seeing the national spend on research on brain tumours increase to a level equal to or better than those other cancers where survival statistics have improved and remain elevated. As part of this, we've been campaigning for a lead to chair a cross-departmental task force, so covering both Department of Health and Social Care and the Department of Science and Technology, to oversee and ensure there's a plan to progress research. And we want the government to actually put their hands in their pockets and spend more because we know currently the research investment is about 90% covered by charities and only about 10% comes from the government. In addition, we want the government to financially support translating research at stages where barriers have existed. So supporting those startups and those spin-outs who have had a promising therapeutic, but investment is really challenging for them to secure. The second commitment is about the government to enable growth of a sustainable research ecosystem to drive innovation and to translate that to patient benefit. And here we're asking for a joined up approach to funding research, not silos. So we want the NIHR to work more closely with UKRI, so that's the Medical Research Councils, for them to identify more novel funding models to make sure that we can fund right across the pipeline. We also want brain tumours to be a strategic priority for UKRI and for them to support career development schemes to encourage the brightest and the best to come into research on brain tumours. And we also want clinicians who are absolutely committed to service delivery, so about seeing patients, but we also want them to have their time bought out so they can contribute to research. So they're combining seeing patients with delivering research of lots of different flavours. And then our third commitment is an increase in the number of brain tumour clinical trials and the percentage of patients accessing those trials in the UK. It's really difficult to get firm figures on how many patients with brain tumours are accessing clinical trials, but at the moment we think it's less than 5%, and we want that to double over the coming years. So there we're asking the government to help support by building a more attractive financial and regulatory environment for pharmaceuticals to invest in drug development, because only through that will we get more clinical trials. We want an opt-out system where patients are automatically enrolled in trials, and we want 100% access to whole genome sequencing with fresh frozen tissue, because that opens up more clinical trial opportunities for patients. And finally, we also want brain tumours to be mandated in cancer innovations that the NHS is rolling out. Things such as multi-cancer, early detection tools, and trials database. So that was just giving you a bit of a context of what we've been campaigning for over recent years and will continue to. So using these as our steer, we've been campaigning solidly for traction on these. And we are pleased that the National Cancer Plan will start to address many of these asks over the course of its 10-year delivery, recognising some will be delivered much sooner than others, but we'll absolutely keep pushing to make sure that progress is made. So moving on to how, as a charity, we've helped influence the National Cancer Plan. In addition to those approaches and tools that I mentioned before, we submitted responses to the National Cancer Plan. We're members of Cancer 52, which represents the rare cancers community, and I know they've been very active in this space as well. We've met with ministers, we've liaised with the teams who drafted the plan, and we've also been very involved in the Rare Cancers Bill, which is currently making its way through the House of Lords, and we've been helping to shape that. And again, I'll come on more about the Rare Cancers Bill and how that plays a real role in the National Cancer Plan. So clearly, all of this has paid dividends, because I'm about to go on and tell you much more about what the National Cancer Plan means for patients with brain tumours. So we believe that it really is a moment of celebration. There are 6 chapters of the National Cancer Plan. One of those is dedicated to rare cancers, and as I said, brain tumours is included in that chapter. Another chapter is focused on world-class research, which we all know is absolutely essential if we're going to make progress and ultimately find a cure for brain tumours, and in the interim, at least find more effective and kinder treatments. And a third chapter is centred on children and young people. And again, that's important for us because one of the 3 main cancers that affects children is brain tumours. And brain tumours are cited 22 times in the plan. As we all know, brain tumours have historically had poor survival rates and limited research investment compared with more common cancers. The plan introduces several important changes that I'm going to take you through now. First of all, recognition of brain tumours as a priority. For the first time, rare and less common cancers receive a dedicated chapter in the National Cancer Plan, elevating brain tumours from an afterthought to part of the core strategy. And there's also recognition of the low survival rates of brain tumours and a need for a more concerted effort to address this. A national lead for rare and less common cancers will be appointed to ensure strategic oversight and visibility. The second key highlight is faster diagnosis and treatment. Strong commitments to meet the NHS cancer waiting time targets will mean quicker referrals, diagnostic tests, and treatment starts. Commitment to reduce the number of brain tumours diagnosed in emergency settings, which currently stands at nearly 50%. And this is an important addition to measure progress because, as you all know, we cannot stage brain cancer in the same way as other cancers. So in a way, it's a bit of a proxy about where cancers get diagnosed. And we all know we need to improve diagnosis and not have patients finding out their cancer at the A&E. The third headline is improved access to trials. So patients will be able to find and access clinical trials more easily, and they'll be able to use NHS systems like the NHS app, which is going to integrate a trial matching. So it's going to be something called Be Part of Research. So patients are going to be able to use this Be Part of Research through the NHS app to be able to identify clinical trials that they could be eligible for. And we know that's important because brain tumour patients traditionally have the lowest trial participation rates of any cancer type. There's going to be a new Cancer Trials Accelerator, which will make NHS the first choice partner for cancer clinical trials. And as I said, a commitment to increase recruitment to trials, particularly for those with rare cancers. So an ambition to increase recruitment and also an increased ability to find out what clinical trials are available as well. Which leads on really nicely to the fourth point, which is about genomic testing and personalised medicine. So the plan includes expanding genomic profiling so patients can get tailored treatment recommendations. And this is vital for brain tumours because we know how important molecular subtype will be to guide the therapy that's available. So we know that genomic sequencing was committed to in 2018 by Matt Hancock. That was offered for all brain tumours, but we also know that that's not happening. So it's great to see a reconfirmation or affirmation and a pledge to address that in this plan. The fifth highlight is about specialist care and surgical advances. So more patients with rarer cancers will be treated or reviewed at specialist centres with multidisciplinary expertise. And there will be an expansion of robot-assisted surgery nationally, which may improve precision and reduce complications. The sixth highlight is support beyond treatment. So all patients will receive a personalised cancer plan, including mental health, lifestyle, employment support, and long-term rehabilitation. The seventh highlight relates to research and innovation. There's a commitment to increase research spend for rare cancers, and there's also a commitment to innovate procurement mechanisms to stimulate innovation in cancer diagnostics and treatments. And the eighth headline refers to the Rare Cancers Bill, and I mentioned that the role we've been playing with Scott Arthur MP, who's been driving this forward. There's a commitment to implement in full the contents of that Rare Cancers Bill, which is incredible news. So I've covered the key headlines. What about implementation? Because it's now taking this into delivery. So we clearly need to make these commitments happen, and I'll talk about this more further on in the webinar. So I've shared with you the highlights, what we're really pleased about, but there are some limitations and there are some uncertainties. So whilst it commits to rare cancers, there are some gaps. So there's no ring-fence funding specifically for brain tumour research within the plan. So obviously progress will depend on wider research investment decisions. Implementation timelines. There are some timelines in the plan, but they're quite vague. So we don't know when the appointment of the Rare Cancers Lead will happen. We don't know much more about the trial access system. So we really need further definition of the timelines to get this plan up and running. And low-grade tumours, which we know for a lot of our community consider that these are often overlooked, we're a bit concerned that they're not particularly explicitly considered because they are often not thought of as being cancer. So great news at 75% ambition to be cancer-free or surviving well for those patients with cancer by 2035. This is bold and ambitious and absolutely the right commitment. But for brain tumours, we know that our community is currently looking at a figure of just 13% survival figures. We don't want our patients to be in that 25% that aren't hitting the target. So we'll be keeping a close eye on this because it's a really ambitious target to be able to get from 13 to 75%. But we know the plan has taken a look at this, and they state that they want to be in the top quartile across 28 countries for survival, for including brain tumours. And currently we're in the bottom 2 quartiles. So we'll be keeping a close eye on that and making sure that progress is being delivered. Another gap is this is a plan for England only. And of course, for our community, we know that our patients will be representing Scotland, Wales and Northern Ireland. So we need to understand more about how it will work for the devolved nations. Prevention is rightly a big focus in this plan, but again, for nearly all brain tumour patients, there's no known risk factor. So we need to just bear in mind that that has less relevance for our community at the moment. And there's a gap about workforce. We're expecting a 10-year workforce strategy, and this plan will require not just more staff at the NHS, but staff that are equipped better with skills, education, training, motivation and equipment to deliver those reforms. So all eyes will be on that workforce strategy. What else is missing? There's very little detail on funding and implementation. We know that there's funding being allocated for the first 3 years of this plan, but we know that this is a 10-year plan. And we also know that this plan will extend beyond the next general election. So we need to keep a close eye and make sure that it doesn't get unsettled by any changes in the political landscape. And even if, there's delivery within this current government period, we're obviously keeping a close eye on the leadership of the Labour Party. And if any of those secretaries of state positions move over the coming years, then that could have an impact and an effect on delivery of this plan. What else is missing is innovation. So there is a big focus on how novel, innovative screening, diagnosis and treatment will play a big role. However, we know that innovations do not currently include brain tumours, and this can be for a variety of reasons. It can be biological, and it can be because of the low numbers of patients, which means for some of these tools that actually the algorithms for risk assessment just don't work. So we need to ensure that brain tumours are not left behind with the revolution of innovation, but we are pleased that the plan does commit to incentivise inclusion of rare cancers in future trials of multi-cancer early detection tests. So again, we'll be looking out for that and making sure that gets delivered. Cancer vaccines gets a mention. There's a promise to roll out up to 10,000 vaccines, but so far brain cancer has not been included. And there's no mention of the role of UKRI, so that's a government funding agency, and investment at the discovery end of the pipeline. The focus is all on the Department of Health and Social Care and the National Institute of Health Research. And to be able to discover and develop new treatments and innovations, we know how important it is for the system to be better joined up, covering the full length of the pipeline. So looping back to our campaigning commitments, we will continue to engage on these, but now with the reassurance that many of these are contained within the National Cancer Plan. Things such as a research investment, a lead to oversee and plan progress, and the clinical trials, so more access, tissue sampling and whole genome sequencing. And so I'm going to finish on what the next steps are. So for us as a charity, and we ask you to help support us with this, we need to start asking the right questions to monitor progress and to understand what the Department of Health and Social Care expects to achieve each year so that we can continue to hold them to account. The all-party parliamentary group and brain tumours will be a great vehicle for reporting on progress against these recommendations, and we will ensure that the plan is a standing item at those meetings. Cross-party groups and any forums in Wales can be used to discuss the England plan and how this might affect patients in devolved nations, because we don't want those patients to be left behind. And the 2 new leads for rare cancer will be invited to the all-party parliamentary group for brain tumours to provide updates. So when they're appointed, there will be 2 leads, a clinical and a research lead. They will be invited to come and join us to outline what their remit is, and they will be asked to come back and provide updates. And we will continue with our approaches to policy makers. We've got good working relationships with DHSC and NIHR, as well as with the UKRI. And it's clear from the plan, both from its generation and its publication, that charities and our voices are much respected, noted, and will be heard. And we know that those government departments can't deliver this plan in isolation. They need to work with us, and so we will be reaching out and offering our support. And we will continue to work as a community through our APPGs, through our membership of Cancer 52, as well as through our task force. So that is my update on the National Cancer Plan, what it means for the brain tumour community, and what we're going to be committing to do to ensure that this gets implemented. So I'm very happy to open up for questions now. If people would like to put their electronic hands up, I'm very happy to answer any queries or questions you have about the content of the plan, what your concerns are, how you think we can work together better. Any questions? Daniel, thank you. Hello. Do you want to come off mute and put forward a question? Thank you for joining today.
Well, thanks for having me, Karen. I am just delighted to hear all the work that you're doing. I was unaware there was so much going on in the background. I'm a patient, and luckily enough, a trialist as well, hopefully as of the next couple of weeks. My question is, how do you work with other charities? So the brain tumour charity is one I'm most familiar with. I'm assuming your work works nicely together.
Thank you, Daniel. That's a fantastic question, because I think for us to be able to get traction with this plan, it's about us as a community joining forces and being a united voice. So we work very closely with the other charities. So let me give you a couple of examples. The Rare Cancers Bill, that's been very much led by the Brain Tumour Charity, by ourselves, and by Pancreatic Cancer UK. And so we've been working very much as a collective to be able to see that get through the House of Commons and the House of Lords. Last week at the APPG, myself and Cameron, who's my counterpart at the Brain Tumour Charity, we gave a joint reflection on the National Cancer Plan. And we also have a lot of working groups. As an example, we're chairing a working group to raise awareness of tissue sampling and whole genome sequencing, where we brought together all the charities in this space to make sure that, again, that we're having a joint voice, and we're not duplicating, but in fact adding value and all pursuing the same ambition. And as I said, we're members of Cancer 52 and Less Survivable Cancer Task Force as well. So Daniel, does that help explain how we're coming together as a community?
It does, and very, very comforting to hear as well. Thank you, Karen.
Thank you, Daniel. Was there a question in the chat? Let me just have a look. No, that was just from Dearden saying thank you. That's a helpful and positive update. Any more questions? I'm really happy to answer anything that might be on people's minds. Oh, Alexa, thank you.
It's actually me.
Hi, Sue. Thank you.
Hi, everybody. I'm Sue Castle-Smith from the Marketing Communications team at Brain Tumour Research. Daniel, first of all, good luck on your trial. I hope that goes well for you. Yeah, really interesting update, Karen. Thank you. I'm not sure it's a question, it's more of an observation, actually. I'm particularly interested in access to trials. the NHS app be part of research, and patients being able to use that to identify trials that they may be eligible for. That sounds really exciting and potentially very game changing. But of course, at this stage, we don't have any idea on timescales for that, do we? Do you have any insider info on that?
No, thank you, Sue. Access to clinical trials, as you know, is so important. We get approached by patients all the time. And again, as a community, Daniel, we've been working with others in this space. We were trying to identify what the best clinical trial finder would be, but we're delighted that the NHS has decided to really push forward, be part of research. But any idea on timescales, implementation, is still up in the air. So we will absolutely be following up with that to find out what their ambitions are, and when hopefully we can share more with the community about how to access that and what it would actually mean in reality. So it's good news, but lots more to find out. If nobody has, then I'm just going to say thank you so much. It's been lovely to see so many of you online. And for those people that are external to the charity, please do get in touch with me. We'd love to hear more from you. There will absolutely be call to actions from us to you as we find out more about the National Cancer Plan, and we will be sharing more with you through our regular communications. So don't hesitate to get in touch with us. And thank you so much for joining, and speak soon, I hope. Thank you, everyone.